So, all right. I would like to thank everyone for coming out to what is, if everything goes well, our last virtual large industry council, C2C, K2J, all the wonderful things that we're doing today. So we appreciate you guys being here today. We are again doing this virtually just to be, out of precaution and also the ability to be able to record this session. So this session is being recorded. And want to thank you for coming to today's C2C, LIC, Government Affairs, and K2J meeting talking about employer options surrounding the COVID vaccine. We felt that this is a very timely topic, and as the vaccine continues to roll out, as Arkansas has now expanded Section 1B, as it was announced that the president and the U.S. government has ordered enough vaccines to be able to get everyone vaccinated by May. So it raises some questions about what happens if an employer chooses not to get vaccinated and a company mandates it or things like that. So we have a wonderful attorney, Katie Campbell with Friday Eldredge Clark, that is going to be talking through it with us today. But before we get started, we do want to thank and recognize all of our sponsors that have made all of our chamber programming as well as this program specific possible. And I know we do have a few that were not able to make it onto the call, but we do have some that are in person as well. But we're just going to start in actually doing this alphabetical order, as since there's no favoritism here. But we are just going to start with our presenting sponsor is Bancorp South. I do not believe, I don't think Robin was able to make it, but just in case, was anyone from Bancorp able to be on the call today? All right. Well, we do want to thank them for their continued support. They are a longtime sponsor of the Large Industry Council, and we welcome their support and want to appreciate them and all that they do. Our other presenting sponsor, if my screen will cooperate here, is BHC Insurance. BHC Insurance, I believe, does employer benefits, and Corey Hall is the representative there, but he was not able to make it today. Our other presenting sponsor is ServPro, and I do know we have Brian on the call.
Hey, thank you, Steve. Appreciate that. Appreciate all that the Chamber's been doing as we've worked through these trying times. You guys have really helped us keep it together, like that. I am Brian Diversary with ServPro. ServPro is a service professionals for water, smoke, fire, mold, and sanitizing. One of our core principles is community service. With the Arctic blast that we experienced several weeks back, we had the opportunity to serve hundreds of businesses and families in Northwest Arkansas. Our staff took in several hundred phone calls during the first few days of this event. Well, it was like drinking from a fire hydrant. We kept the phone lines open the entire time. The number of job leads was overwhelming. To serve as many businesses and families as possible, we asked ServPro Corporate to help with crews and equipment. They sent in hundreds of pieces of equipment to add to our inventory. They also sent ServPro crews from franchises in Alabama, Florida, and Iowa to help right here in Northwest Arkansas. And many of those crews are still here, staying at the local hotels, eating at the local restaurants, while they service, our community. We have worked long hours over the past few weeks to serve as many businesses and families as possible. It's been tiring, but we are thrilled to help so many folks during this time. We appreciate all the opportunities. And back to you, Steve.
Thank you, Brian. We appreciate that. And we love having the people that you brought in from out of state staying and shopping locally. And if you did not see the State of the City address earlier this week, it was reported that while the sales tax collection for the city of Rogers did not reach the budget expectation, it was still higher than 2019, and so did set a new sales tax collection record. So having those people come in from out of town and shopping locally is definitely helping with that as we kick off 2021 as well. So thank you for that. Our meeting sponsor is One Digital. Let me get your logo up here. And is it Tamara or Tamara?
It's Tamara.
Tamara. Okay, just wanted to make sure I had that correct. So Tamara, please.
Yes, hi. Thank you, Steve. One Digital Health and Benefits is the leading strategic advisory firm in the United States. And we have been in the business for over 20 years working with employers of all sizes, helping them manage their employee benefits anywhere from medical to dental to life insurance, disability. We also are very involved in the human resources side of business, providing lots of tools and services for employees that don't or employers that don't necessarily have a true human resources staff. We're there to help them and make sure they stay in compliance, because as we all know, if you're not in compliance, it's going to cost you a lot of money potentially. We also are involved in the property and casualty business as well. So now we're able to bring to an employer all of the services, including retirement. So we can work with you in your employee benefits, your human resources side, property and casualty, as well as your retirement programs. We have offices here in Arkansas in 4 different locations. Here in Northwest Arkansas, Fort Smith, Little Rock, and El Dorado. And then, of course, our corporate offices are in Atlanta, and we have serve over 50,000 clients across the United States. So we would love to have an opportunity to talk to any of you that might be interested, but we're thrilled to be able to help sponsor this today.
Thank you very much, Tamara. We appreciate One Digital support. Again, you guys have been a longtime sponsor of the Chamber as well as the Large Industry Council. And also love the fact that you're relocated from Springdale up to Rogers for your office. So always love to see that as an economic developer. So, all right. Our final sponsor is our Chamber to Community Builder sponsor, which is Black Hills Energy. And I do not believe Charlie was on the call today. But we do want to thank them for their support as we go through all of our Chamber to Community programming throughout 2021. Which is a good transition, talking about how this program is being recorded as part of our C2C program, and all of our virtual C2Cs are available on our Chamber YouTube page. So you can go to YouTube, RLACC, and have access to our video library for subject matter experts across a wide variety of topics. So that's my last shameless plug for the Chamber. I promise that's it. So we're going to go ahead and turn this over to Katie Campbell. Katie is an attorney, as I said, with Friday, Eldredge Clark, and she is practices in Litigation Practice Group with them, and is a litigation counsel for individuals and businesses in complex businesses and commercial disputes, including employment claims, collective action, wage and hour claims, and breach of contract matters. So without further ado, going to turn it over to our expert, Katie Campbell.
Hi, good morning, everybody. Thanks so much for having me. I'm looking forward to talking with y'all. As Steve said, this is a very timely issue. We're getting tons of questions about the COVID vaccine, and especially just in the recent weeks when we've really seen the rollout of the vaccine coming more to industry and to employers, we've started to get more and more questions. Just an update as to where we are right now with a few things. You know, as Steve mentioned, the governor has opened up vaccines to the phase 1B. So we are seeing more people starting to have access to the vaccine. Anecdotally, I can say that I know more people who've gotten it. I have more clients who are getting access to it. So I do think that this is going to become a more commonplace question and issue as we go into the next few weeks and months. The governor has announced that all of the COVID-19 related directives have been changed to instructive guidance now. And so those are no longer the force of law. Those are just instructions and guidance. We still encourage employers to follow those. But it is no longer, legally required at this point. The mask mandate remains in effect through at least the end of this month. And so stay tuned for that, for Governor Hutchinson to announce additional changes on that front. I was just looking at the Arkansas DHS website, and it looks like more than 500,000 doses have been given of the vaccine already in Arkansas, and 281,000 individuals in Arkansas are fully immunized. So we are making some progress on the vaccine. And like I said, I think that will just continue to increase. If you have questions, feel free to include them in the chat function, which I've already noticed some people have, which is great. Would love to make this as interactive as possible. And I will address those at the end. And we can also take questions, if you want to speak up as well. One other update that bears mentioning, because it does relate to getting people vaccinated, the CDC just this week released its guidance for what vaccinated individuals can and cannot do. And so they've said that vaccinated people can visit inside without masks, without distancing, with other people who've been fully vaccinated. And the key really for employers is that they don't have to quarantine or do testing if they have a known exposure to someone with COVID-19. So that will keep all those people who are vaccinated in the workforce and not having to do that 7, 10, or 14-day quarantine, which I know is a major issue for everybody. That said, there are some things that they're saying that they should still do, and that would include continuing to wear masks in public and in the workplace, just because we don't have enough people who are fully vaccinated at this point. So keep the mask and distancing going, avoiding large gatherings, getting tested if you do have symptoms, and then minimizing non-essential travel. So at this point, still not seeing people doing any kind of business travel. So mandate, incentivize, or educate? That is the question that I'm getting every day, multiple times a day. And so this survey done by the Littler firm at a national level shows that 6% of employers currently, this is a couple of weeks ago, currently plan to mandate the vaccine. 43% were unsure, and 48% said they did not intend to vaccinate, but rather incentivize or educate. The top 3 reasons for not mandating the vaccination in this survey was resistance from employees, the impact on company morale, and then some legal liability associated with adverse reactions. That third category I'll address at the end. I think that's probably some misinformation, but that is this national report that's going around. And I'll tell you that based on the clients that I'm helping, this is about what we're seeing. The only clients who right now are mandating it are in the healthcare industry, people, 1, who have already had access to the vaccine, and 2, who are really coming into contact with people. But most clients at this point are incentivizing it. And I think that we could see some changes as the vaccine becomes more available, but I'll say that this is pretty representative of what I'm hearing from clients. So can employers require the vaccine? This is a question that I'm getting, all the time. And the answer is yes, with some caveats that we'll talk through today. So high level is employers can require their employees to get the COVID-19 vaccine. But if they do that, they have to comply with a number of laws, including the Americans with Disabilities Act, Title VII, and a few other things, which we'll discuss. Like I said, practically speaking, this is not an option right now because there's just not the availability of vaccine needed. But I think that these are issues that are important to think through now, develop your policies, get ready to work through your accommodations so that you're ready to go if that is the plan that you want to go with. At a high level, in order to require the vaccine, you do need to show that an employee would be a direct threat to the workforce. And the EEOC has said that exposing other people to the virus would meet this requirement. So really the only thing to keep in mind here is that if you have an employee who is working from home all the time, still working remotely and might not come back, it would be harder to show that they're a direct threat. And so that's one of those caveats that you might not be able to require a fully remote employee to get the vaccine. The EEOC released guidance in middle of December through the form of a question and answer to kind of walk employers and employment lawyers through the COVID vaccine and how that would interact with the ADA and various other employment laws. So I'll walk through those things today, but just so you know, we do have EEOC guidance, which is helpful. I will tell you in a number of areas from the EEOC guidance here to what you can do to incentivize your employees to religious accommodations. All of those things are really in flux. I'll due in large part to the administration change. So there were some regulations issued at the end of the Trump administration that the Biden administration has signaled that they might roll back. So I'll flag those for you as we go through, but I say all this to say that we still have some unanswered questions, and then some unanswered questions may change slightly. So as with all things, we have to continue to monitor and just stay nimble as we go through all of these COVID related challenges together. So the key thing about the EEOC guidance was it said that administering the vaccine is not a medical examination under the ADA. So employers don't need to show that it's job related and consistent with business necessity to administer the vaccine. That is a very legalese way to say that you can mandate the vaccine. And they said it's a direct threat by exposing other employees to the virus. So that was really the big news out of that guidance. The second big news out of the guidance was it said that the pre-screening questions that you have to ask before you get a COVID vaccine can trigger the ADA. So you will want to be careful about what you ask before somebody, one of your employees, gets the vaccine. So the way I like to think about it is the guidance draws a distinction between offering the vaccine on site or bringing a third-party administrator onto your work site to give it. So that's the first bucket. And then the second bucket would be having your employees go to a pharmacist or their doctor and then come back to you with a certification. If you are administering it in that first bucket on site, there are a lot more considerations. You have to be a lot more cautious in terms of acting basically as the vaccine administrator. That's how the law will view you. So any questions that you ask could trigger the ADA. You'll have to think about those types of concerns. Whereas if you just have them go to their own doctor and provide a certification, that is not implicated. So my advice to employers, particularly those smaller size businesses, is just to, even if you're going to mandate it, to have folks go to their own primary care doctor, their pharmacist, and to get it, outside of the workplace. That way you don't have to go down the road of, following all these pre-screening protections. I will say, while I'm thinking about it too, is that if you do require the vaccine, any time that will be spent in getting the vaccine is compensable. So if you've got hourly employees, you will need to pay them for the time that they are, traveling to the vaccination site, getting vaccinated, and then traveling home or back to the office. So just something to consider. So can an employer ask employees questions about the vaccine? Here, I would caution you to be very careful. Like I said, asking employees for medical information can trigger the ADA, and you don't want to get into any disability related or health related or genetic information related questions. So I would caution people not to ask, do you get vaccinated a lot? What are your pre-existing conditions that could, make you more reactive to a vaccine? Do you have a family history of, vaccine reactions? That kind of thing. That is going to open up a whole can of worms. You are certainly allowed to ask, are you sick today? You're certainly allowed to ask, have you gotten your COVID vaccine? But just avoid getting too specifically, into the details. And if you were going to go down the road of administering the vaccine on site, where you would have to ask those pre-screening questions, you would need to show that you have a reasonable belief, that they pose a direct threat to the health and safety of others, and go through that ADA analysis in terms of, whether you can ask those questions. Again, can an employer ask for proof of the vaccination? And they certainly can. You can ask them to go to a pharmacist or healthcare professional, get the vaccine, and show you their card. There's no issue with that, and that would not implicate the ADA. So again, probably emphasizing this too strongly, but I do think that this is probably just the more efficient, easy way for employers to handle that. So like I said, there are some caveats to mandating the vaccine. If you're going to mandate it, you do have to accommodate people with disabilities or people with sincerely held religious beliefs. And so I'll walk through both of those with you. I will say I'm certainly not a doctor or a scientist, but so far what we're hearing from those professionals is that there aren't too many people with pre-existing conditions or health conditions that are not going to be able to get the vaccine. I'm not saying there aren't any. I know pregnant and breastfeeding women, that has been one group that they've told people to exercise caution with, and there might be a few other types of conditions that would maybe your doctor would advise not to get it. So, but that would be the kind of disability that we're talking about. Anybody who has a pre-existing condition or another health condition that would make them, ineligible for getting the vaccine, basically. So if you have an employee come to you and say, I can't get it because of, the condition that I have, again, without going into details about what they have, you must determine whether that unvaccinated individual would pose a direct threat due to a significant risk of causing harm to the safety of others in your workplace, whether that's employees or your customers and clients. So just because they say, I'm not going to get the vaccine, you cannot immediately terminate. You do need to talk with them about their concern. And so you do have to walk through this risk assessment. And I will caution, as with everything in the employment HR space, these are all going to be very fact specific. And there's not a one size fits all on this. So you're going to need to think through the employee, their position, their health condition. But you would want to think through the duration of the risk, the nature and severity of the potential harm, the likelihood that potential harm would occur by them not getting vaccinated, and the imminence of the potential harm by them not getting vaccinated. As I said earlier, the EEOC has said that a worker poses a direct threat to the workplace if you would determine that they could spread the virus at work. So right now, that is kind of erring on the side of mandating the vaccine. But like I said, it's fact specific. So the more people who are immunized in the workplace, the harder it's going to be to show that they're posing a direct threat, because they're not going to be able to infect those people who are already vaccinated. So this analysis will probably change over time as the vaccination levels rise. Also, if you've got somebody working at home who's really never coming into contact with anybody, it would be harder to show that they're a direct threat. So just all things to keep in mind. The other issue is an employee can object based on a sincerely held religious belief. And the law views this very broadly. And as I'll talk about in just a second, it views it even more broadly recently under some new guidance. And so the presumption should be made that the belief is sincerely held, and you're going to want to walk through, what about that belief prevents them from getting the vaccine. So, and in the religious context, you must provide a reasonable accommodation to the employee unless it would cause an undue hardship on the business, which the law defines really in terms of economics. So that, I think, would be harder to show. There are going to be a lot of unanswered questions about the objecting on a religious beliefs standpoint that are going to have to be, ironed out and figured out over the next few months. But I think that this one will be a little harder for employees to force somebody who has a sincerely held religious belief to be vaccinated. So the big question is, what is religion and what does this mean? There's some new EEOC guidance out just from the very end of 2020 that significantly expanded the definition of what religion is. And so they include that a lack of religious faith actually falls under their definition of religion. There are a lot of words here, but if you I'll just pull up the highlights. So it says religion doesn't include just your traditional religions that we think of, like Christianity, Judaism, Islam, but it would also include beliefs that are new, uncommon, not part of a formal church or sect, and only subscribed to by a small number of people, or that seem illogical or unreasonable to others. They need not be confined to the traditional parochial concepts. It basically just needs to occupy a place in a person's life parallel to that filled by God. So it really looks at religion not in terms of the traditional concepts, but just in terms of ideas that concern ultimate ideas about life, purpose, and death. So, I mean, this is brand new, first of all. So nobody has had time to experience a case with this. This really opens up more questions than it answers. But I just want y'all to be aware that that this really does open up a whole Pandora's box of potential religions. And so the key here is just whether it's sincerely held. I mean, and so is your employee, really saying this from a genuine perspective, or is this something that they, last week they were fine with getting the flu vaccine, but now they're saying, oh, I can't get the COVID vaccine because it's against my religion. So it will be a case by case basis, but just wanted you to be aware of this new guidance. And like I said, this really does open up and muddy the waters in terms of what can be discussed from a COVID perspective, but also caution you, to tread carefully about what you can ask the employee about the religion. You're not going to want to go into too many details other than to suss out whether it really is a genuinely held belief. Interestingly enough, the guidance also states the denial of a religious accommodation absent undue hardship is actionable, even if there's no adverse action taken. So in other words, if you deny the religious accommodation, but you don't otherwise, terminate or demote or something like that, it's still an actionable offense under Title VII, which is new in the employment space. As I referenced earlier, the undue hardship when it comes to religious accommodations is something more than a de minimis cost. So this would be if it diminishes the efficiency in the workplace or causes a potential hazard, or it's burdensome on the workforce. And so I think here, again, like with that ADA analysis, it's going to be harder to show the more people you have vaccinated. So It's going to be fact specific on the employee side, but it's also going to be fact specific on the employer side as to whether, once your workforce is 60% vaccinated, are they really, creating a hazard or causing an inefficiency? So I've kind of talked through, you can mandate it, except with a, disability or Title VII religious belief. And so if they do raise the disability or the religious belief, then you need to determine if you can accommodate that employee. And so factors you consider are going to be the employee's job function, whether there is a need for a vaccine in that particular role, like is that person interacting with clients on a day-to-day basis? Are they customer facing? Or are they sitting in an office with a closed door by themselves? I think all of those things will play in pretty significantly. And is there a remote work possibility? Or is there an alternative job that the employee could do until more people in the workforce get vaccinated? So a lot of this stuff I've been saying since March of last year that we're flying by the seat of our pants, but I think we're still doing that somehow. So we're all learning as we go. And so these are all things to consider, but I don't think that there are any clear answers at this point. But those would be things that to consider, and that will continue to change, I think, as we see vaccinations increase. So if you have gone through all the analysis, you're requiring the vaccine, the employee cannot get it for a religious or disability reason, and you've determined that you can accommodate them, then what do? And you can lawfully exclude them from the workplace at that point. So I would caution you, to think through the implications. I mean, under the EEOC guidance and all that, you can exclude somebody who won't be vaccinated. Certainly, if they don't have any religious or disability issues, you can exclude them if they won't be vaccinated. And even if they do have some kind of disability or religion that prevents them from, if you can't accommodate them, you can exclude them. But just make sure when you're doing that, that you're not unintentionally targeting a select group of people. You're going to want to make sure that it's applying across the board and you're not running afoul of any other issues. So if you get into any of these situations, whether it's an accommodation request or you're thinking about terminating, I would caution you all to reach out to somebody, just on the employment law angle, because these things can, always are a little tricky. I wanted to draw your attention, you probably have already seen this, but HB 1547, we're getting a lot of questions about this. There is a bill that has been introduced in the House, the Arkansas General Assembly, that would prevent employers from mandating the vaccine. I know that this has really worried businesses who are thinking about doing it or maybe have already started. I will tell you, from a legal angle, I don't think that this will pass muster, even if it is passed, just because the federal government who regulates the space has said, that you can mandate them. The governor's office has come out against this, and for the most part, the chamber and the business side of things, they're opposing this. And so this was getting a lot of press in the last week or so, but I'm hearing that this will probably not move forward, past this. But just wanted you to be aware that it's out there. And mostly if you had questions that right now I'm telling people don't worry too much about it, because I don't think that this is going too far. So that's all about mandating the vaccine. And I think that it has a lot of benefits. The vaccine in the workplace is going to have a lot of benefits. It's going to increase efficiency because it's going to keep people there. They're not going to have to quarantine, it'll make people healthier, all of those kinds of things. But it does come with the downsides of having to go through the ADA and Title VII analysis of accommodations. And the other thing that we're seeing is, employers are concerned that if they mandate it and your employees refuse to get it, then you're stuck in a hard spot of either having to enforce your policy and lose your workforce, or not enforce your policy and keep people around. So, and I will tell you from my own experience with my clients who are encouraging the vaccine, about 60% of people, of their employees at this point, are getting it. So, which I feel like that's a pretty good response. And I think that the more people who get it, as we'll talk about a little bit down the road, and the more people are modeling that, probably that number will go up a little bit. So something to consider. So most of my clients are considering more of the incentive track as opposed to the mandating track, just because they are worried about losing workers and they're already seeing a fairly good response to the vaccine. So you've probably seen in the news that many large corporations are giving these incentives. So Kroger is giving a $100 cash bonus. Amtrak is giving 2 days of leave. Target is giving paid time off, paid transportation. Dollar Tree is giving 4 hours of pay. So these are all things, and I'll discuss these in more detail, that are open to employers to do, and just to encourage the employees to get the vaccine. So if you're going to encourage as opposed to require the vaccine, you'll want to develop a clear written policy. I should backtrack. I think if you're going to mandate the vaccine, you should have a written policy as well. So in either event, have a written policy, but you'll want to clearly detail that the policy is fully voluntary. You're going to want to offer education about the vaccines to your employees. I have seen just through my own clients that education goes a long way in this space. There has been a lot of misinformation about the vaccine and about side effects and, other, healthcare conditions that interact with it, that the science and doctors have said, no, that's not really the case. This vaccine is, we were actually on with the Arkansas Department of Health with Dr. Joe Thompson, and he was talking about, of all the vaccines, this one has the lowest adverse reaction that he's seen, and and that's very safe, and just kind of walking us through that. So I think educating the workforce and leading by example, that's going to go a long way. Obviously, covering the cost of the vaccine will encourage people to do that. Providing time off to go get the vaccine will help. And then you can go even a little bit beyond that by providing something that I would say you're going to want to stay within the de minimis level. So, something, a small amount, a small gift card, or paid time off. So a lot of my clients are providing a day of paid time off, mostly, and they can tie that to the, if you have a side effect from, I think particularly the second shot is what I'm hearing, is that you might have a little bit of a side effect that would give you that day off to recover from that. And if you end up feeling great, then you get an extra day, but you've encouraged your employees to get it. So like I said, that's where people seem to be leaning, although you can really go about this either way. Other things to consider with the incentives. So if you are going to pay any kind of cash bonus, you would want to include that in your regular rate calculation for your overtime. So if you have your non-exempt hourly employees, and you provide them with a $50 gift card to go do that, you would need to calculate that into your overtime rate. The other thing is for ERISA, and I know just enough on this front to be dangerous. We've got wonderful employment benefits lawyers in our office who I've talked to about this, but basically she just advised that you're going to want to provide incentives just through PTO or a cash bonus, as opposed to through your employer provided healthcare plan. That just creates its own level of complications. So you don't want to, mess with the employer provided healthcare plan, would be my high level guidance. But if you get too far down the road, I can offer more guidance offline about that. And the other thing is, and I've gotten this question a lot from folks, is, okay, so if I'm just incentivizing the vaccine, but I'm giving somebody a $50, Sonic gift card if they get it, but I've got somebody who has a disability or a sincerely held religious belief, so they aren't getting the $50 Sonic gift card, isn't that discriminating against those people? And the EEOC has, through kind of, cryptic guidance, they don't come right out and say that, but they say that that could potentially be an issue. And so what we're advising in that case is to talk to those people and offer them an alternative. So you could give them a 30-minute video to watch about COVID and the benefits of the vaccine, or whatever the case may be, but to offer them an alternative COVID-related way to get the same incentive, because recognizing that they really might not be able to do that. So just something to consider. Again, if you were to do that, I think that you'd want to, walk through the same analysis that we talked about. Do they really, are they just trying to get the gift card, or, is this something legitimate? And those are all things that you're able to do. So here I've listed probably the most common questions that I'm getting on this. Some of this we've already covered, but do I need to have a vaccine policy? The answer to this is yes. I would encourage you to have a written policy, whether you have an incentive program or a mandatory program. I think it's always good to telegraph this to employees. And I also, with that, I think employees are starting to have a lot of questions about the vaccine and about what's going to happen, when the mask mandate may or may not go away. And so OSHA recently released some pretty good guidance that basically said that all workplaces need to have like a COVID point of contact and a COVID response plan. And I think a lot of people have already informally done that. I mean, it's common sense. You're getting a lot of questions about COVID. And so somebody has naturally stepped up and just started answering those. So I think that person needs to be prepared to answer the vaccine related questions as well, point people to where they can get them, point people to Dr. Joe's video about the vaccine being relatively safe and, you know, and all that kind of stuff. And so I say all that. So have a policy, but also have some kind of, even if it's informal, plan to educate the workforce and to, you know, a go-to resource for questions. Can I ask employees if they have been vaccinated? The answer to that is yes, but again, like I said earlier, I'd caution you to keep that as, you know, a yes or no question as opposed to going into details, you know, about why or why not or anything like that. But you can certainly ask them if they've been vaccinated or for the, you know, proof of their card. Related to that, I've also gotten some questions about whether employees could be disciplined for providing a fraudulent COVID card. We haven't gotten to that point yet. I hope we don't, but you know, I appreciate the skepticism. So the answer is yes, you could discipline them for that if it comes to that. Can I require only certain employees to be vaccinated? And so this question has come to me a lot in the fact that, you know, there are going to be people, for instance, bank tellers who are going to come into contact with people all day, every day, who might need to be vaccinated, whereas your, you know, IT person at the bank sitting in the back room by themselves who never sees anybody wouldn't have the same need. And I think the answer to this is yes, as long as you treat everybody consistently and you can have a business reason as to why you're doing it. So if you can point to the people who are, you know, interacting with people the most, being required and others not, I think that's fine as long as you're consistent. Are you required to pay for the vaccine? If you mandate it, you are. If you incentivize it, you are not. But I think covering it is a good idea in terms of encouraging people to do it. It'll just be one less roadblock. And I will say our wonderful employment benefits lawyer also told me that if they get this through any kind of employment provided healthcare plan, that should cover it 100%. So most people are saying that they are not having to pay out of pocket, which is a good thing. Can I administer the vaccine on site? Again, I would caution against this just because it gets you into all those ADA question territory that makes things a little bit more complicated. So if you have the option, my suggestion is to send people to their doctor and just require proof. And then the final question is, can employers be held liable for the side effects an employee may have from the vaccine if they've mandated the vaccine? This is an ever-evolving area as well, but the general thought is that no, if you've mandated the vaccine, that your workers' comp coverage will cover that. And there are some laws from the early 2000s that support that as well. So employers should be fairly well protected from that. That's just, this here is just a link to all of our coronavirus coverage. If you'll have further questions, in the EEOC and recent OSHA guidance that I mentioned is there as well. Let's see. Looks like we have a few chats that I can open up. So this question comes from Kathleen. It says, if someone has been fully vaccinated and travels to a country that is level 4, example, Mexico, do they still have to follow CDC guidance to quarantine? I think the answer to that is no, as long as they are not symptomatic. The CDC has said if you're symptomatic and even if you have a vaccine, that you would need to get tested and follow those, you know, treat yourself as a presumptive positive after presumptive exposure. So I think you'd be good as long as you don't have symptoms. I think somebody wanted me to share this. Is this the slide? Oh.
Yes, thank you.
Okay, sure. But like I said at the beginning, I mean, this is an ever-evolving area and guidance continues to come out, particularly now that we have a new administration. And so I just encourage everybody to stay up to date. And our firm does try to send out newsletters. And so if you're interested in signing up for those, you can go to that webpage there. Excuse me. Anybody else have any other questions?
Well, for not seeing any questions, I think that means you did a great job. That's what I'm hearing. The
hope so.
silence is showing how wonderful of a presentation that was.
She did, in fact, do a great job, Steve. So thank you very much,
Oh,
Katie. It was
absolutely.
very informative.
Oh, it was very, very informative. Is there a chance for anyone for our registrations or registrants to get a copy of the presentation, or
Oh,
is that
sure.
something just we can rewatch the video if we need to?
Yeah, I will send that to you when we get off.
Okay, great. And then I will send it out to the Large Industry Council group, as well as all of the people that registered for the C2C.
Very good.
So, all right.
Everybody, it's good seeing you.
Thank you very much, Katie. We appreciate it. That was, again, some great information. So we are grateful for you taking your time out of your busy day to come and talk with us about this. So as I mentioned before, this is recorded. We will be uploading this onto our Chamber YouTube page, and we'll be promoting the link as well through our social media. So you guys, if you know someone that needs this information, please feel free to share them and link them to this video. And once again, we do want to thank all of our sponsors for today, which was Bancorp South, BHC, ServPro. Our meeting sponsor was One Digital, and our C2C community building sponsor was Black Hills Energy. So thank you guys very much. We're going to get you out of here a little bit ahead of time, which is always a good thing. Get some extra time back in your day. So you need it because the clocks are springing forward this Sunday. So we've given you 45 minutes of that time made up. So all right. Well, thank you guys very much. And our next Large Industry Council meeting will be in June. And as I said, as everything goes, we are planning to have that done in person. And I will send out the information to that group once we know the topic and speaker that we will be talking on. So thank you guys very much, and enjoy your weekend.
Thanks, everybody.
You too. Have a great
Thank
weekend,
you.
everyone.
Bye.
Bye.